Okay, hi. Again, welcome. So our first conversation is about food as medicine, which you've been hearing a lot about this morning. There's been conversations around access and equity already. So what we want to actually dive into is what does this mean and why this matters for health outcomes. Just to set the stage a little bit, we're not just talking about access to food, we're actually talking about nutritious food and what kind of food we have access to, because we are as only healthy as our community. So as we learned very, very, very much around the pandemic. So we're going to kick it off with that. I'm going to have the panel. Will you guys please introduce yourself? You represent different perspectives in the food and nutrition space. And I'd love to hear from you about how does solving for nutrition access play a role in breaking down barriers and social determinants?
Go down the line? Okay. I'm Joe Moreno. I'm a senior investment analyst at Village Capital. We are a global entrepreneur support organization that really backs founders that are supporting and building solutions for underserved communities. As far as to answer your question, I think food is like this connected tissue to a whole host of social determinants, such as race, income level, physical location, culture. So if you're solving for nutrition access, naturally you're going to gain insight into a whole host of barriers that are social determinants. And it's not to say that food may be the sole tool to address these barriers. However, viewing things from a food lens will provide, in my opinion, very valuable insights because of where food sits within our lives in this interconnected web.
My name's Emily Foxman. I oversee global initiatives at the Baylor Collaborative on Hunger and Poverty. And I would echo all the things that Joe just said here, too, and talk a little bit about our approach to the way that we conceptualize food and nutrition access and how that interfaces with healthy food and healthy outcomes for communities and individuals. Baylor Collaborative approaches food access and nutrition through 3 prongs: research, policy, and practice. And so a lot of our work is interfacing with how do we connect the upstream and downstream factors that contribute to healthy outcomes for our communities and our families. And so zooming out a little bit, we know that the social determinants of health, we have to think about the conditions in which we live, we work, we play, we age, and that those have an enormous effect on our health outcomes, whether that's diet-related disease, whether that's chronic illness, whether that is something even outside of those areas. Things like education, transportation, healthcare, all interface with the food systems and the way that we need to be thinking about these issues as well. And so, one of the things that I think I would add to that too is that we often kind of conflate food and health outcomes with individual choices and behaviors, right? If I ate better and I exercised more, then maybe I wouldn't have chronic illness. And really, when we're talking about how can we better design interventions and policies and transform food systems and disrupt these issues, we really need to be thinking upstream. So that's where we really focus our work.
Hello, everyone. Good morning. My name is Taylor Newman, and I'm the Director of Nutrition at Kroger Health, which, if you didn't know, is the healthcare arm of Kroger. So we've got dietitians, pharmacists, nurse practitioners, all helping our customers live healthier lives. And I think you bring up a great point, Emily, about how the focus does tend to be on individual choices, but it is so much more structural barriers. And I think that nutrition, while just one piece of the health puzzle, there's medication adherence and sleep and physical activity, it is so tremendously important because what we eat can impact our health. So at Kroger, we are consistently trying to remove those barriers and do it in a way that's very inclusive and meets people where they're at. I think in nutrition, especially from a dietitian lens, it can be very dogmatic of this is healthy, this is not. And what we need to do is meet people where they're at and bring that inclusive lens.
So we've already touched on a lot of the themes that you've been hearing around this. Joe, I'd love to have a bigger conversation with you because Kroger Company and the Zero Hunger, Zero Waste Foundation recently partnered with Village Capital to do a market assessment. As we've been discussing, there's a lot of thought and funding around this, and we want to make sure that we're doing it right. So we took some time to look at the landscape, see what was out there, and you actually came back with some really interesting findings. So would you share a little bit of that report with the room?
Yeah, I'm happy to. And kind of the overall objective of the report was to identify relevant solutions within healthcare that improve food, nutrition, and health outcomes, particularly for low-income folks and people of color. So in doing so, I honestly took more of a healthcare approach and identified 3 solution types that, in our opinion, are positioned to improve health equity for low-income communities, for people of color. Some kind of, I guess, considerations I certainly had were, do these drive better health outcomes? Are they affordable? And are they accessible as well? And in doing so, 3 of the solution types I identified were digital health and nutrition services. So think of delivering telenutrition in a 12-week program based on chronic condition or to prevent chronic disease. These companies are receiving a lot of VC investment. It was about $1.7 billion since 2018. So pretty well capitalized, but also a little more clinically validated compared to other solutions. You're seeing more commercial health insurers reimbursing for these services. You're also starting to see more Medicare Advantage, more Medicare payers pay for this as well. And we are transitioning, in my opinion, to a point in which Medicaid reimbursement is a bit more common for these services. I think one limitation that we identified, though, was that digital health and nutrition services often don't address the root causes of poor diet, of food insecurity as well. And next, we identified kind of a catch-all term for social determinants of health for improved food and nutrition. So these are companies that are addressing social determinants that have the downstream effect of improving food security, improving health outcomes. And you can think of a company that screens for social determinants, identifies unmet needs, and then can automatically enroll someone in, let's say, SNAP benefits. So these companies were receiving, it's about $437 million since 2018, so not as well capitalized, but they are becoming more common in being reimbursed by Medicaid. So this means that they are more accessible and affordable for low-income folks. And one limitation, or I guess 2 limitations we identified with this is, one, the services that are available to individuals and benefits are really dependent on robust state policy. Some states provide more benefits, others are a bit more limited. And then food security doesn't exactly translate to improved nutrition, for example. Food security could be access to food all up rather than healthier food, rather than kind of changing behavior as well. And I realize this is a long-winded answer as well, but the third bucket was food as medicine. And for the purposes of this report, we define food as medicine as companies that are not only building more prescriptive programs for chronic disease, for prevention, but then also getting food to people's doors. So the first part of the solution type is very similar to digital health and nutrition services, but getting food to people's doors was the key differentiator. These companies are not as well capitalized, receiving about $178 million. And part of it, in my opinion, is that they're not as clinically validated just yet. But what you're seeing out of California, Oregon, Arkansas, North Carolina, and Massachusetts is promising. These state governments are running pilots to get food to people's doors, pay for it with Medicaid funding, and actually, in the case of Oregon, run educational programs too. I think what you're seeing is these are basically laying the framework for validated clinical outcomes, and hopefully will shift policy across other state lines as well. So a long-winded answer.
Yes, no, thank you. I wanted to share what we were looking at with the report with the room and everyone at home. And you actually brought up something that, Taylor, I don't know if you would speak a little bit to, because if you're thinking about, food as medicine, it actually has to go all the way to the door. So he tied in access very well in these states that are looking at this. And I know that Kroger is actually looking at delivery as well. And here you guys might have seen some of the really beautiful billboards. It's coming and it's happening here. But we've been thinking about how that could open access up down the road too.
Yeah, I mean, when you mentioned, Joe, the telehealth piece, so Kroger does have telenutrition services in which our Kroger Health dietitians can meet one-on-one with patients and help them navigate the grocery store. But that's just one piece. I think the other key piece is actually getting food to someone's door. There are a lot of transportation barriers, especially more in low-income or vulnerable communities. So I think that piece of actually getting food in people's hands is key. And yes, so previously Kroger had no brick and mortar in the state of Texas until recently, and still no physical stores, but we have a delivery service that just opened in Austin, and so it's at the very beginning of inception, and you can now order groceries through Kroger and get them delivered to your door. And this is really unique in that we can navigate those barriers to access to food. You don't have to live near a store. You can get food directly delivered right to your doorstep, and pair it with dietitian services so that you can navigate what those healthful choices are for you.
Emily, with the different buckets that Joe outlined, is there any solutions there that you personally think are really important from your vantage point, and with the idea, too, of scale?
Yeah, I would echo the emphasis on access to food as being one of the strongest barriers, and also one of the largest opportunities to strengthen food security and nutrition security moving forward. The Baylor Collaborative launched an intervention in the last couple of years called Meals to You, which focuses on the same kinds of questions of how do we overcome barriers around transportation, particularly in areas where what's working in rural communities isn't working. And so we were seeing from our research and from our field work that the solutions that we were seeing for summer meals, in particular for child nutrition programs, weren't reaching rural and frontier families. And particularly, there were extra challenges for folks in indigenous communities, for folks in extremely hard-to-reach areas, and for folks where summer meals were not really possible to reach what's called congregate meal sites, or where you go in person to pick up your meals and also ideally receive some academic enrichment opportunities. And it's a great program, and it's something that we really encourage for congregate to be possible wherever it can, but in certain areas, it's not feasible. And so what we were experimenting with is we developed a pilot called Meals to You that home-delivered summer meals to children's doorsteps in rural, frontier, and indigenous communities. And we launched in East and West Texas in 2019. We had about 40,000 families that we were working with then, and then the pandemic hit. And then in 2020, we thought we were going to originally scale to about 4 states, and instead USDA asked us to scale to 43 states and Puerto Rico. Wow. And so over the last 3 years, we have been piloting Meals to You. We've now reached 40.2 million families and meals that we've delivered through this program. And really that's working on how do we address these gaps when summer meals are already under-enrolled for across the board in the United States, but particularly in areas where transportation is a really huge issue. And so access is really key to thinking about how do we ensure that folks have equitable access to healthy, nutritious food.
I love, too, the way that you frame that in a very entrepreneurial, innovative mindset. I think no matter what sector we work in and the way that we approach, we can have that problem-solving, thinking about scale. And the fact that USDA said, you figured this out already, help us do this bigger. That's just so encouraging, I think, for all of us to hear, that these solutions can come out of our organizations and be scaled with partnership. So thank you for that point. And Taylor, I just want to go back to you for a minute, because I don't know if I'm the only one here who had no idea that there was a dietitian at Kroger. So you think of this large retailer. I mean, not to be belaboring it, but can you just talk a little bit more about the day-to-day and some of the tools that you're mentioning? Because I didn't even know this existed.
Yeah, I get that a lot, surprisingly. People don't really realize that grocery retailers care about health or invest in health, but at least at Kroger we do. And so I'm a dietitian by background, and I lead a team of dietitians, and we work on food as medicine strategy every day. I also work with a team of dietitians who are patient-facing, so they are meeting with patients every day to navigate any and all health and nutrition problems or questions via telenutrition, so virtually, so we can meet with patients all across the country. And I think what's really unique about a dietitian in a retail setting is that people go to their grocery store a lot more than they go to their doctor's office. It's where they go 2 to 3 times a week with their family. We have millions of customers every day standing in the aisle who are looking at different packages, reading nutrition facts labels and ingredient statements, and it is confusing. I am a dietitian, and nutrition, I can verify, is very confusing, ever evolving. And so for a busy mom who's trying to make healthy choices for their family, it makes sense that they're having trouble or it's overwhelming in the grocery store aisles. And so what we try and do, my whole goal, is to simplify that process for our customers and remove the guesswork. And we do it via telenutrition. We also have a nutrition rating system that essentially we trained an algorithm to think like a dietitian, so it can provide expert guidance on what a healthy option is for someone. And I think just to drive home the point that the grocery store really can be a healthcare destination and a source for expert and credible resources.
It's a community center. I mean, if you think about it, this is a place that we go to buy the food that feeds our family. Something that I learned about that I'd love for you to explain is recently that I can actually take my cart and check the nutritional value of it and get guidance to make smarter decisions, which is so cool. When you're thinking about, like, I'm running around, I don't know how to even read this label, the idea that I can know what's in there and then have that feedback. Do you mind just talking about that tool?
Yeah, so I was touching a little on it. That's that algorithm that we trained to think like a dietitian, and it's called OptUp, and it's a nutrition rating system. Essentially takes into account all of the different attributes of a food or a beverage, and it populates a single score on a scale of 1 to 100. The higher the rating, the healthier the product. And to your point, Natalie, it can give kind of an aggregate score. So think of it like a health credit score based on your grocery purchases. And you can track your progress over time to say, oh, I am purchasing healthier products. I'm on my way, meeting my health goals. Or maybe there's room for improvement. I'm noticing that I'm buying a lot of Oreos, which I love Oreos, and all foods fit. But just give you that information so you can make choices that are right for you.
So, Joe, I want to go back to you because, food as medicine has become very talked about recently. I don't know how many people here were familiar with the White House conference on hunger, nutrition, and health. It was the first time in 50 years that we gathered all the various stakeholders from the private sector to agriculture to the government programs. When this happened 50 years ago, that's how we got programs like SNAP. So it was time that we sat down and looked at what was working and what wasn't. And this happened last fall. And there was, I want to get the number right because it's pretty astonishing, $8 billion in commitments from around the country about doing this work. So as I mentioned in the onset, one of the reasons we wanted to do a gap analysis is to make sure that all the work wasn't overlapping and where are people going. Will you speak a little bit about, after you're absorbing the findings that you were sharing, food as medicine as a solution? I mean, do you think that's the place that we should lean in?
In my opinion, yes, for a couple reasons. First, at least from a venture capital standpoint, these solutions aren't receiving as much money as others, so I think it provides a lot of room to run. But not only that, I think we're kind of at the precipice of food as medicine companies being adopted and actually reimbursed from Medicaid. So what's coming again out of California, Oregon, Arkansas, North Carolina, and Massachusetts, I think is promising. Some of these pilots are actually ended and in the measurement phase right now. And I think there's an opportunity if in that measurement phase it becomes clear that, hey, we reduce chronic disease, patients were engaged with the solution. I think that really sets the table for more widespread adoption. However, food as medicine solutions aren't the turnkey solution, in my opinion, in part because you need to think about how can people actually afford the food, are there transportation barriers to actually getting to and purchasing products as well. So you would need to, in my opinion, combine food and nutrition services with solutions that improve social determinants, ultimately affordability and access.
And thinking about it as an investment opportunity is really interesting. Here at South by, we have tech and funders in the room, storytellers in the room. That's one of my favorite things about this conference is it really brings so many different mindsets together around problem solving. And you do talk about investment in capital, and I think that we can all think about that. You know, how are we thinking about our portfolios around food and food systems and access and the opportunities there? And even Emily, to your point, the scalability of this work. Will you speak a little bit more on, from the populations you've been working with and then now expanding to all these different states, do you see food as medicine as that solution? Like, tell me a little bit about some of the positive, stories that have come out of this work.
Yeah, I think food as medicine is still a relatively new concept, as you were saying, and really a lot of opportunity there to dive into what some of the structural kind of recommendations might be there to really build out this kind of framework. Really central to the work that we do at the Baylor Collaborative is the idea that no one sector, no one organization, no one individual can end hunger alone, can improve health alone, can solve for nutrition outcomes alone. And so I think the conference provides a really good example of that. The White House Conference on Hunger, Nutrition, and Health is how do we get all of these different actors working in concert with one another to overcome these really complex structural challenges and really create and reimagine systems where safe, healthy food is the easy economic choice for all. And so I think that takes bringing folks together. One of the previous ambassadors said that the world doesn't organize itself, right? So how do we get grocery retailers combined with researchers, combined with public sector, with industry, with healthcare, all at the same table to talk about what role we play in these large upstream features and where are there entry points for us to work together and cultivate scalable solutions? What does it look like to build something that's replicable, to build something that can be tailored and adapted to different contexts? What works in Austin isn't going to work in Minnesota. What works in all these different areas needs to be culturally relevant, community-driven, and really backed by a diverse constellation of folks.
I'd like to ask you a follow-up on that. Do you find that people are listening to the actual community members around the solutions and how they're working? Has that been part of your process? And I'm so encouraged that the work that you were doing on the ground is, rather than the government trying to recreate a version, they scaled up the work that was already working. But will you speak about the importance of having the community at the center of that?
Yeah, particularly when we talk about food as medicine and nutrition and health outcomes, really if the work isn't anchored in equity, centering community voices, lifting community preferences, then you're really not going to make it very far. And so something that's been really encouraging to see just within the public health space and within the food space as well, when we think about quantitative and qualitative research, is really there's more and more emphasis on focus groups with community members, conversations with your neighbors, talking to families is just as important a data point as a survey or as something like that. And so really when we talk about dietary preferences, meal frequency, creating healthier patterns, if it's not culturally appropriate, if it's not acceptable, if it's not something that's interesting and relevant to the community itself, then you're kind of operating outside of what's going to really move the needle.
Thank you for making that point. I know I sprung that on you, but it's so important, right, to think about the people we're trying to serve and having them have a seat at the table. And yes, I meant that little, the table we're all at. And this group is very engaged. For all of you that are at home watching and joining us in Austin, I see a lot of people who potentially may actually have work that overlaps. So if we do have time to go to Q&A, I'm going to check with them and ask if I'm going to try and open it up just so we can get a few questions. Before I do that, though, I have, for the panelists, would love to, and Taylor, I'll start with you. If there is something around food as medicine, a solution that you really feel, personally, I think that the way that we approach our work actually is so important in this. So the hat you wear and the way that you're looking at Kroger and coming to work every day, is there something here that you really want to share around that call to action?
I think my personal call to action, especially at Kroger, is taking the unique position of the grocery store and knowing what an impact we can have on millions of lives every day, and take that position in order to make food more accessible, especially healthful food, remove any kind of confusion around what's healthy, and work to make sure that we can get food in the hands of people who need it most. So I think for me, that is what wakes me up every day and gets me inspired to go to work.
Joe?
I would say I personally would ask for input from people who are particularly outside of the healthcare system as well. I think that, at least in my report, I took a very healthcare-centric approach and did not focus on more upstream solutions, such as food production, such as supply chain as well. And there are companies that are building contained agriculture facilities, growing food in low-income communities, selling to nonprofits, and providing food at very discounted rates or even for free. And I'm not naive to the fact that there's more solutions out there. There's always going to be a role for nonprofits as well. I think the work that U.S. Hunger has done to measure social determinants and then hopefully be able to predict what interventions are necessary it's paramount. And more input from people who are experts outside of healthcare is what I would ask for, so that we can better inform multiple stakeholders on kind of how to provide support and in what form for this White House call to action.
Yeah. Yes, thank you. That's a very important point. Emily, you're an Austin local, so yay. We love that. Will you speak a little bit about this new piece of legislation that also is important and promising?
Yeah, this is an exciting week for food as medicine in Texas. There have been 2 bills that are filed, one in the Senate and one on the House, to launch a medically tailored meals pilot for Medicaid recipients in Texas. And so medically tailored meals, Joe, you talked a little bit about this, but is really an intervention for folks who are at risk of or already experiencing diet-related disease, and to create sort of boxes that are tailored to resolving, mitigating, or ideally preventing the onset of these chronic illnesses. And so this would be the first time that it would be coming through a public policy instead of a private partner. One of the pieces that you talked about was the challenge of reimbursement rates and some of the more systemic challenges that are sometimes associated with this. So we're extremely grateful to our sponsor, Senator Johnson, who filed the bill in the Senate, and Representative Oliverson for supporting these initiatives, and for the Texas Food Policy Roundtable and Houston Food Bank in particular for championing that effort and getting these bills off the ground.
I actually have similar experience of really having it championed in Washington. We worked really closely with McGovern's office, who has been so passionate about this and the White House conference, and to your point, using their power to help healthy food get where it needs to be. So I've actually can say, we often can be too jaded. The private sector is stepping forward, saying, how can we be here? The legislators are, it's a bipartisan, awesome opportunity for us to work across the aisle together. I think that's really heartening at this time. So thank you for sharing that. Does anyone want to add something before I open up to questions? Okay. I saw so many shaking heads, and it just looked like a very informed audience. So I'd love to give the opportunity for a question. I don't know if there's an extra mic, or you know what? I can repeat the question back so everyone at home can hear. So just give me a little signal if you have anything you want to add, contribute, share. Right up here up front.
Scream it out, okay.
Yeah.
My name's Steve from Austin. You get a lot of stories of trust. And for one example, is during the pandemic, Kroger's own employees were at the food bank, but they weren't getting salaries and wages that even could help them buy any food, let alone healthy food. So how does Kroger, who's sponsoring this, I understand, thank you for sponsoring it, get away from it? You don't treat your own family, your work family, properly. How are you going to treat the rest of the world properly?
Do you want to repeat?
So the question was about, really thinking about your employees as an extension of this. And, I know that the question was directed at Kroger, but I want to make mention that this is something that companies across the nation are really thinking about. Taylor, do you want to add anything specifically?
Yeah. I think it's an amazing point. Essentially, knowing that our associates are part of our family, and that access to food for our associates is just as important as it is for the rest of our customers. And I totally agree. And I think some of the ways that Kroger is delivering on that promise for our customers and for our associates is through Zero Hunger, Zero Waste, which is the sponsoring entity for this talk. And that is our philanthropic arm, who plans to donate 3 billion meals by 2025. for folks so that they can have healthy food on their table. I think some other ways that we're taking into account the need for affordability for everyone, especially now of all times as food prices rise, is bringing savings to the forefront. So more and more we're trying to incorporate and bring coupons, discounts as you're shopping in our stores and online. So now if you are shopping and you're going to check out and you've missed a coupon, Kroger will prompt you and say, hey, do you want to go ahead and click these coupons so you can go ahead and save money? So more and more we're trying to bring that to the forefront. I'll also say we're trying to bring out SNAP online. So as we are a large retailer, it has taken us quite some time. The online SNAP pilot came out in the pandemic, and it was kind of forced and rushed, and now we've taken the time to get it right for all of our stores, and that will be rolling out soon. So that's another way that we're trying to encourage savings for customers and for associates.
And also, that's another example where you have been actually pushing the federal government around how we're folding SNAP into online delivery. So it's actually not just the company moving, it's trying to innovate with government programs is not easy. Is there anyone else? We have one more question.
Okay, sorry. I was curious, like at a grocery store like Kroger, how do you think about the business case for food as medicine internally? I imagine. I used to work in grocery, and there's so much money that comes from CPG, and not all of that is healthy. And so, how do you think of? Is it loyalty? Is it public good, or is there like a bottom line reason to do it?
It's all of it. I think, yes, it's public good and social impact. I think Zero Hunger, Zero Waste Foundation would agree with me on that. But I do think that it is meeting customer demand. We're not making this up. Our customers truly do want increased access to healthful food, and it is confusing, and they are looking for solutions. And so when I go into, I'm obviously a healthcare provider going into other areas of the business like merchandising, and my job is to convince them that health matters. And luckily, it's not too hard of a story to tell because food is so human. So I think there's an element that makes it something that easy for the business to get behind, but it does support loyalty, and it can support the bottom line in addition to just being the right thing to do.
And I'll add that the foundation work and like even the report is something that can help inform strategy for the business as a whole. I work on impact strategy with big brands, and we look at not only what do we do, who do we serve, the communities that we're in, but how that's a part of our value proposition as a company and how we show up in the world. So I'm very passionate about what you're asking, and I actually think that as we look to the future, we're going to see more and more because companies need that to stay relevant. This is what, as you put, this is what people want. They want to know that they are a part of a company's success in a way that they're taking care of the communities that they're in. And Joe, I don't know if you would just add from the perspective that you and I have spoke a lot about the report, and I think even a higher level opportunity to say, some of the solutions could drive for any business. Like we looked at this and said, this might just be something that is not only helping a certain community, but this could actually be something that can help a company as far as the growth and scale.
For sure. I think that at least within Kroger's approach, they can go much further and reach a lot more individuals with the Food as Medicine program. Again, we took more of an approach of looking at solutions, particularly for low-income communities, and I think there are gaps to be filled that either private companies can step up and do, or there, as mentioned, there's always a role for nonprofits too. How to support those businesses, I think, is to be determined. That's why we're asking for input. But nonetheless, I think multiple stakeholders adopting Food as Medicine programs, serving all types of demographics is important, certainly, and I think there's a business case to be made as well.
Well, thank you guys for being here. We have a lot more discussions to come. And we want you to, stay hydrated and say hi, as Denise framed at the beginning. Please come and introduce yourself and tell us about your work. Thank you, panelists. It was an amazing conversation.
Thank you so much. Thank you.